Hey guys, welcome back to Anchored at Harbor Park. I'm your host Jason. I'm here with my guy Christian of Doctors of Physical Therapy.
My pleasure.
We are going to talk a little bit about body rehabilitation. We do some intense stuff. We push ourselves hard, and one thing that happens is inevitably you're going to get sore, you're going to get a little bit beat up. So I wanted to bounce some ideas off of you.
Absolutely.
But first, let's tell them about who you are, what you do.
So my name is Christian. I work with Doctors of Physical Therapy here in town. I'm an athletic trainer. I've been in the field for about 10 years. I've worked with semi-professional football teams, high school athletes, some lower level professional athletes in the past. My goal and purpose coming to Harbor Park to the gym is to kind of extend our care to the CrossFit athletes within the gym, and also kind of troubleshoot any kind of complications or any kind of kinks that you guys may have throughout your workout regimens, and kind of keep you on the straight path of continuing without stopping.
Okay, cool. So let's break it down into like 3 kind of tiers. I look at it as first is kind of just like your general soreness. You get a good workout, you're sore. So talk to me about that, like what kind of maintenance stuff?
So typically, if you're, as you're starting to get into your CrossFit, it's pretty well known that, the workouts are really strong and straightforward, and, you're giving it all your energy. So a lot of times, the onset initially for someone just starting is going to be a lot more aggressive than the person that's obviously been doing it now for 6 months to a year or more. So I'd say a lot of times it's keep up with your stretching, keep up with the mobility. You have great tools that a lot of people know of, and that's heat and ice. So know when you have sore joints, and you could throw heat or ice on them, just depending. I mean, if it's an injury, you kind of want to stay away from the heat initially, because that's just going to promote too much inflammation. You just try to decrease a little inflammation at the point of an injury. But if it's soreness, it's muscle fatigue, use hot packs. I tend to stay away from the balms, because they don't really, there's not like scientifically proven that they can penetrate that deep into the skin. Sometimes it feels good, which isn't bad, but a lot of times people start to figure out their regimen, whether they like to, post stretch, even before they go, like pre-stretch before bed, after they wake up, they'll stretch again. And then kind of get into the whole heating. A lot of times a hot shower kind of makes you feel good. Loose.
For sure.
So I mean, that's also good. But going along with that is kind of like the mobility exercises as you become more.
Just like we do, at the end of class.
Exactly.
But then if you're extra sore or something, you can do some more on your own.
Yep, exactly.
So then the next step would be like, okay, so I tweaked my knee or something. Just not nothing like, you don't need surgery, but it's just not 100%.
Sure. So, there might be a time where you feel that, right? You go down into a deep squat, and then you come up and you're like, man, something caught, didn't feel right. That's when you kind of walk around on it, see how it feels. Obviously, it doesn't feel normal. So your body starts to troubleshoot it yourself. You're thinking in your head, like, what am I doing here? Like, what was it? Did I feel a pop? What kind of pain am I feeling? Dull, achy, or sharp? So, I mean, going based off of that, that's when you kind of know, like, whether you need to seek other kind of professional advice. You could use Doctors of PT, of course. We do free consultations for anybody at any time. So we're just a phone call away. You could call me into the gym if you needed to. If it's one of those days that I'm going to be coming in, and you're like, hey,
Monday nights,
every other Monday. I'll try to come as much as possible. Just flag me down and just kind of explain to me what's going on. A lot of clients have used us for that, and we found that we've been a positive resource to the gym.
For sure.
And we've troubleshooted a couple things and gotten people back, and then some people are like, wait, this is a lot more complicated, and we find it to be more complicated, so we try to guide them into the right path to make sure that they can get back into the gym.
Cool. So that's kind of like, I got my bum knee right now.
Yep.
I can't do a full squat because that's when I get pain, but I can do some partial range of motion stuff. Some deadlifts seem to be okay. So it's kind of just listening to your body to see what it's telling you.
Utilizing your coaches. There's obviously modifications that you can do to your workouts. If you feel like you've done something and you're not quite sure, but you want to give it a couple days, talk to the coach, what kind of modification can I do to keep up with my exercise and not just totally go sedentary and not do anything anymore. There's lots of modifications to this great world of fitness, and CrossFit, you know, definitely, you know, provides that and really motivates you and tries to keep you going so that you don't fall off the
wagon, totally.
Yeah.
And then, okay, so then the last thing I want to run by you is kind of like major injury, like torn calf, broken ankle, something like that. And now it's becoming more and more common. You see it on Instagram. People are like actually trying to do stuff like, I know a couple people, one torn leg or torn calf, and they're doing stuff with like single leg or like a leg on a bench.
Yeah.
One was an Olympic weightlifter, and she was doing like cleans from her knees and just extended hip. Still trying to get some of that stuff going. Yeah. What are your thoughts about that kind of stuff?
So it becomes kind of touchy. You know, a lot of times you have to respect your body. It's talking to you. It's saying, you know, slow down. Something traumatic just happened.
Right.
You know, definitely if you do suffer a torn calf, or, you know, if it's as bad as a broken ankle, you're definitely going to want to talk to your doctor, you know, and just be like, hey, what is it that I can't do? Because there's restrictions and things like that. A lot of people like to take things to another level.
And obviously these people I'm talking about are competitive. Like they have a very specific goal, like one being the Olympic weightlifting, so like trying to make the Olympics. So, and that's a little bit different scenario.
Yeah. So, I mean, it all depends. And it really is all about listening to your body. It's all about, you know, being aware of the damages that you could do if you're not really doing the things appropriately. You know, someone's competing at the highest level possible with Olympic lifting. They know their body pretty well. They have people scoped on them. Like, this is what you can do. This is what you can't do. You have weight bearing restrictions. It's a whole nother, you know, process. But I think for someone that's coming into this gym that maybe even competitive, it's always take a listen to your body. Utilize your resources. You know, there's a lot of great resources, your coach being your first resource, and then someone that's offering any kind of services to the gym on the outside.
Right, like these guys.
Utilize them as a resource. Because then, you know, obviously we work with doctors hand in hand. They send us patients. We treat their patients. They get outcomes. So, I mean, ultimately it's utilizing and getting yourself into this nice big circle of healthcare providers. You know, obviously you guys are offering the exercise health behind it. And so then here comes, you know, physical therapy, athletic training, sports medicine kind of stuff that'll kind of nip the pre and post kind of things for you, stretching, the rehabilitation part and things like that. And then you have your doctors. Ultimately, they're the ones that are going to be like, hey, you know what, maybe give it a couple weeks off and then do some physical therapy, but then get back into the gym, you should be good to go. So it's all about, you know, kind of always protecting yourself at all times, but also utilizing the resources that are available to you.
And being smart, obviously.
Yeah, absolutely.
Cool. Awesome. So that's about wraps it up for me. Why don't you tell them where they can find out more about what you guys do, who you are?
Sure. So we have a website, doctorsofphysicaltherapy.com. I know it's pretty long. We're located on 101st and 74th Street on Highway 50, right across from the Olive Garden. We're right next to a foot and ankle doctor called Wild Foot and Ankle. And we're also located on the north side on 39th and Washington Road. So it's right behind the Family Video. They're actually just put a new pharmacy right next door to us, Good Value Pharmacy. So we're in that little strip mall there, right by Bradford High School.
Cool. And then Facebook, Instagram, any of that stuff?
Yeah, we're on Facebook. We have a Doctors of Physical Therapy corporate, and then we have a Doctors of Physical Therapy Kenosha South and Kenosha North.
Cool. Yeah. Cool. Awesome. And then for us, Facebook, Harbor Park CrossFit. We got the YouTube channel. Make sure you subscribe there. Sign up for our email list, and you'll get notified every time these videos come out. They'll just get sent right to you, so then you don't have to wait. Thanks so much, guys.
Thank you.
Thank you, Christian.
Thanks, buddy. Appreciate it.
All right.